Let's begin with a fundamental concept. What exactly is a disorder? In the realm of medicine, understanding this term is crucial for both healthcare professionals and individuals seeking clarity about their health. A disorder is defined as a medical condition that disrupts the normal, healthy functioning of either the body or the mind. This disruption can manifest in various ways, affecting physical processes, cognitive abilities, emotional states thereof. It's important to recognize that disorders are deviations from the body's or mind's typical operational state. To better grasp this concept, think of your body as a finely tuned machine, a complex system with numerous interconnected parts working in harmony. When something's off, when one of those parts isn't functioning correctly, symptoms begin to appear. These symptoms can be physical, such as pain or fatigue, or they can be mental, anxiety, or difficulty concentrating. Disorders encompass a wide range of conditions from physical ailments like diabetes, which affects blood sugar regulation, to mental health challenges such as anxiety, which impacts emotional well-being. It's crucial to remember that these disorders are not personal failings or character flaws. They are medical conditions that require understanding, support, and appropriate treatment. What distinguishes a disorder from a passing feeling or a temporary setback is its persistence and duration. A key characteristic of a disorder is its significant impact on daily life, affecting a person's ability to function normally at work, school, or in social situations. To ensure accurate and consistent diagnoses, medical professionals rely on clear, established criteria to diagnose disorders. This involves a thorough medical evaluation, including physical examinations, psychological assessments, and a review of medical history. Ultimately, the term disorder serves as a tool to help doctors and patients effectively understand, communicate about, and treat the underlying issues that are causing distress or impairment. Whether it's a physical condition like asthma, which affects breathing, or a neurodevelopmental condition like ADHD, which impacts attention and behavior, the core issue at hand is often an imbalance or disruption in the body's complex systems, whether it's the respiratory system, the nervous system, or another vital function. By understanding that disorders are medical conditions, we can replace judgment and stigma with compassion, empathy, and a willingness to provide support to those who are affected. When we talk about disorders, it's easy to focus on the symptoms, the challenges, and the difficulties they present. But the real challenge with disorders is often social stigma, the weight of judgment and misunderstanding that society places upon those who are struggling. This stigma can be incredibly damaging, creating barriers to seeking help and fostering feelings of shame and isolation. It's crucial to remember that the stigma surrounding disorders can often be more debilitating than the condition itself. Many fear judgment, the whispers and stares that can make everyday life feel like a constant battle, or misunderstanding, the lack of empathy, and the assumptions that people make without truly understanding what someone is going through. This fear, this weight of potential negativity often keeps them from seeking help, from reaching out for the support they desperately need. But it's important to remember that disorders are common. Millions live with them, navigating their daily lives, often silently, often unseen, often silently bearing the burden of their struggles in isolation. They don't discriminate. Disorders affect people from all walks of life. Anyone can be affected regardless of age, gender, ethnicity, or socioeconomic status. Open conversations, honest and vulnerable dialogues, isolation, creating a sense of community and shared experience, and build acceptance, fostering a more compassionate and understanding society. Sharing our stories, being brave enough to speak our truths, reveals our shared humanity, reminding us that we are all connected and that we are not alone in our struggles. This, in turn, encourages others to seek help, knowing that they too can find support and understanding. There's no shame, absolutely none, in your health. Taking care of yourself is an act of strength, not weakness. Whether it's mental or physical, seeking help is a sign of courage. Let's change the narrative. Let's rewrite the story we tell ourselves and others about disorders. Disorders are manageable health conditions, treatable and often well controlled with the right support and care. They are not secrets, not something to be hidden away in shame. By fostering acceptance, by creating a culture of understanding and empathy, we empower people to get the care they deserve, to live full and meaningful lives free from the burden of stigma. Myths about disorders can be as harmful as the conditions themselves. People with mental health disorders are not inherently violent. In fact, they're more likely to be victims. Disorders aren't a choice, and you can't snap out of it with willpower alone. The mind and body are deeply connected. Physical illness can affect mental health and vice versa. Seeking help is a sign of strength, not failure. Effective treatments exist. To medication. Managing a disorder is about using the right tools, not about weakness. Let's replace myths with facts and support. Disorders usually result from a mix of genetics, environment, and biology. Genetics can increase risk, but they don't guarantee a disorder. Environmental factors like stress, trauma, or lack of resources play a huge role. Early life experiences and chronic stress can increase vulnerability. Biological factors such as brain chemistry or hormonal imbalances are also key. Physical disorders may stem from immune or metabolic issues. Understanding these causes helps tailor effective treatments. It's rarely just one thing. Disorders are complex, and so are their solutions. Disorders, both mental and physical, touch the lives of countless individuals around the globe. These conditions affect nearly every aspect of health, influencing not only physical well-being, but also emotional and social health. It's important to understand the breadth of these challenges to foster empathy and drive meaningful change. Consider the pervasive impact of mental health conditions, from the debilitating effects of depression and anxiety, which can cloud judgment and diminish one's capacity to experience joy. Then there are chronic physical ailments such as diabetes and asthma that demand constant vigilance and management, impacting daily routines and overall quality of life. Mental health conditions like depression and anxiety are widespread, affecting people from all walks of life, regardless of age, gender, or socioeconomic status. These conditions can deeply impact daily life, making it difficult to maintain relationships, succeed at work, or even perform simple tasks. Attention deficit hyperactivity disorder, or ADHD, affects focus and impulse control, presenting unique challenges in academic, professional, and social settings. ADHD often starting in childhood, shaping the developmental trajectory and requiring early intervention and support. Chronic physical disorders like diabetes and asthma are also incredibly prevalent, requiring ongoing medical attention and lifestyle adjustments. These conditions require ongoing management, including medication, regular checkups, and lifestyle modifications to prevent complications and maintain well-being. These conditions are common. They are not isolated incidents, but rather widespread health concerns. Indeed, hundreds of millions are affected worldwide, highlighting the urgent need for increased awareness, research, and access to care. You're not alone. There are countless others facing similar challenges. Therefore, these are major public health challenges that demand our collective attention and resources. Recognizing the scale helps fight isolation, fostering a sense of community and shared understanding. Acknowledging the prevalence of these conditions calls for better prevention strategies, improved treatment options, and more compassionate care systems. Understanding the global impact is the first step toward addressing these challenges effectively and equitably. By working together, we can move toward a healthier, more supportive world for everyone affected by these conditions. Most disorders can be managed with effective treatments. Medical care, like medication, addresses biological imbalances. Therapy, especially cognitive behavioral therapy, helps change negative patterns and build resilience. Lifestyle changes such as exercise, sleep, and nutrition play a vital role. Mindfulness and routines add stability and purpose. Support groups and community connections break isolation and offer encouragement. Leaning on friends and family is healthy and smart. Managing a disorder is about building a toolkit for a better life. If symptoms disrupt your life, reaching out for help is a powerful first step. Start with your doctor. They can guide you to the right specialist and treatment. Recovery is a journey with ups and downs. Be patient and celebrate progress. Friends and family can make a huge difference. Listen, support, and learn about their condition. Practical help and encouragement matter. With treatment, self-care, and support, people with disorders can thrive. Your condition doesn't define you. Help is available and recovery is possible. Take that first step. You're not alone on this journey. Welcome to my YouTube channel. Don't forget to like and subscribe.